Hi, my name is Jador LaRosa Matis. I am a registered nurse. I am employed in New York, Mount Sinai West Hospital. I've been a nurse going on 6 years and currently working amidst the COVID-19 pandemic.
Mm. So what's your day-to-day experience like working in this sort of a condition? This is unprecedented by any stretch of the imagination.
Well, no 2 day is the same. I want to say it's very traumatic to start. It has gotten a lot better, but in the beginning of this whole crisis or pandemic, I have seen the healthcare system at its all-time low.
Mm.
Um, and one of the things that
In what sense?
I feel that in a way, this is something that no one has prepared for, or when I use the word prepared, it's like you said, it's unprecedented. It's like the uninvited guest.
Mm.
So it's thankfully, even though the healthcare system is very is able to counteract some of the effects that has happened, I feel like it's has been very bad.
Mhm.
In a sense where New York, for example, we had to employ a lot of healthcare workers from outside of the country, travel nurses, doctors, physical therapists, respiratory therapists, because we didn't have enough staff. And a lot of the staff were also either being quarantined or from exposure, or they themselves were getting sick. So it's like we have the hospitals and then we have the overflow. We didn't have enough beds, ICU beds, ventilators, as I'm sure everyone know what's happening in the news or what's happening. So
On the issue of the PPEs, are you now getting more? Are you seeing more PPEs coming in?
yeah, we have more PPEs. Also, we have personnel who are donating to the hospitals outside of the government agencies. So we have a lot of supplies. The general public also were doing donations for masks, gowns,
Right.
what yeah.
That's pretty good. So, okay. One of the things that I think about when I hear people making their own masks and things of that nature, do these masks have to be of a certain grade or certain quality to actually be effective, or any cloth can be used, any kerchiefs?
Well, when this virus was first introduced, there was a lot of debate, or there was a lot of back and forth with the CDC in terms of its droplet, its contact, or now it's airborne. In the hospital, we're treating it as
Now it's airborne.
pretty much. So we're treating it as all three. Um, when I say now it's airborne, it's better for us to, and that's the reason why we're using the N95 mask. So the to answer your question, the masks that people are wearing are making rather, they are effective to some extent. If you're practicing social distancing 6 feet away from someone, um, and these masks are cloth masks. The N95 masks are normally effective in negative pressure and environments. Like a patient who have TB, we normally put that patient in a negative pressure room. Going into that room, we have to be equipped with the N95 mask.
Mm.
Um, outside, and the reason for that is you're also breathing in your own CO2. So in going outside with a mask, it's still effective. Um, it's just that persons who are using, and I believe that any mask at this point in time, whatever you could get your hands on, if you could get a handkerchief, you could get a scarf, as long as you're using something to cover your nose and your mouth,
Mm.
because those are the portal of entry, as our mucous membrane as well. So I want to say, because I wear the cloth mask as well outside, so I believe that they're effective to some extent. Yeah.
Okay. So what have you been seeing in terms of, well, I guess I should say, has there been an increase in cases where uh, the healthcare providers are getting ill because of specifically getting COVID?
In the beginning, there were an increase in cases where staff were getting exposed. And I'm sure you saw on the news, one of the assistant managers at my job, he passed away from COVID-19, and a lot of other.
Again?
Sorry,
Or his name?
Caius. His name was Caius Kelly.
Mm.
He got ill. He was not sure exactly of the nature of how it happened, but he was at work and pretty much got exposed. That he later was developing symptoms, ended up in the ICU, and then a few days later he passed.
Okay.
And also we have quite a few other coworkers who were tested positive and had to be out, doctors, a lot of persons from different departments. Now we've seen a stability in terms of the cases in the hospital being a decline.
Mm.
Admissions to, and when I say the hospital, I'm referring to my hospital that I work. I don't know about, but for my hospital, I've seen it has gotten a lot better,
Mm.
especially with discharges. We have discharged a lot of COVID-19 patients, over 4,000 within the whole entire Mount Sinai system. One of the things that Mount Sinai is doing now, they're doing an antibody test to see if you were infected with the virus, do you build antibody against it?
Right.
Or if you worked as an employee who just want to know if you ever had this virus and just never was asymptomatic,
Mm.
or if you even had symptoms and if you build antibodies, they're offering those tests for us to see if we build antibodies against the virus.
Yep.
I have not seen any readmission as of late or as of yet
Mm.
that I know of in our Mount Sinai system. There is some hope in case if this should have a rebound effect in the fall. I think now the healthcare system is have a head start
Mm.
for the unforeseeable future, and they're preparing. I hope, I mean, you cannot be too prepared, but at least now there is not a delay in taking an intervention. And I think there was a delay in terms of and I hate to get into politics.
Yeah.
I think there was a delay in how this whole thing was handled initially. It was not taken as serious as it should have been.
Yeah. It's a very unfortunate situation as far as that goes, but obviously that's water under the bridge. We
Yeah,
have to just deal with things as they
arise. Mm-hmm.
going forward.
If you're losing your senses of taste and smell, that's one of the big ones that a lot of people thought it was just allergies. Now they're having these little spots on their toes. So there's a lot of different, yeah, there's a lot of different symptoms that's now being added to the list of symptoms.